Good morning. You're now listening to Kingston Community Radio, airing on FM 92.5 and AM 920 WGHQ, Kingston, New York. This programming is brought to you by our listeners and corporate underwriters who are interested in presenting local community radio. The opinions expressed on this program don't represent those of Pamel Broadcasting or Kingston Community Radio. Listeners are encouraged to send in $10 per month to help bring this program to you. Mail your contributions to Kingston Community Radio, Post Office Box 4364, Kingston, New York, 12402. For more information or to donate online, visit our website at mykcr.org. And good morning, this is Dan Gaddis, and thank you for tuning in and being early birds like us and sharing this Monday, March 21st, Medical Monday. 36 degrees right now starting out, and great news, and of course, you may know it already. It's the first day of spring. We'll be right back after these messages.
Jill, why don't you tell the class what you did this weekend?
Well, my dad and I went in search of some magical minnows and found a zillion of them in the stream from our lookout rock. Then my sister and I escaped from an evil slug king and went back to my super twig fort for safety. Then we told stories till it got dark, and the Big Dipper led us all the way home.
Wow! Where were you, Jill?
We went to the forest. It's not that far away.
Ask your parents to take you and your friends to the forest this week. It's closer than you think. Check out discovertheforest.org. Brought to you by the U.S. Forest Service and the Ad Council.
Screening exams for breast, lung, or colorectal cancers are necessary to detect and treat disease at its earliest, most curable stage. But you may have some concerns and questions. Answer your questions and ease your fears by visiting radiologyinfo.org. In addition to information on screening and wellness, you'll find more than 200 descriptions of radiologic exams, procedures, and treatments to help you prepare. Get informed and be prepared. Visit radiologyinfo.org, produced by the Radiological Society of North America and the American College of Radiology.
Hi, this is Anne Marie from the great town of Kingston, and I support Kingston Community Radio, and so should you.
And you're with us at KCR, Kingston Community Radio, AM 920 and 92.5 FM. And stay with us every weekday from 7 to 9 a.m. for our morning shows. 845-331-9255. 845-331-9255 is your call-in number. And a little bit about that, we've got a little bit of a spring weather ushering in our spring day today. Sunny to partly cloudy with a high of 57. And partly cloudy skies tonight with a low of 33. And Tuesday, sunny along with a few clouds, high around 55. And Tuesday night, a few clouds from time to time, a low of 29. Wednesday, considerable cloudiness with about a 50% chance of occasional rain showers during the afternoon. And Wednesday night, 100% chance of a rain shower on Wednesday night. So the first rain we see is Wednesday and Wednesday night. And we deserve it. We deserve this good weather. Okay, and also, Kingston Community Radio and Elks Lodge 550 team up for Breakfast Live Remote. A Breakfast Live Remote Tuesday, March 29th from 7 to 9 a.m. during our show hours. And that's at Kingston Elks Lodge, 143 Hurley Avenue. Kingston cost us $10. Breakfast includes eggs, pancakes, bacon, sausage, coffee, and juice. And Kingston Community Radio will be broadcasting live that morning with Cameron Rylance and Nina Postchapak doing their normal show from that location. So come on and have breakfast with us on March 29th from 7 to 9 a.m. Enjoy the show from right there where you are, because it's going to be broadcast live. Kingston Elks Lodge, 143 Hurley Avenue. All are welcome, and it should be a great time. We'll be right back after these messages.
Jill, why don't you tell the class what you did this weekend?
Well, my dad and I went in search of some magical minnows and found a zillion of them in the stream from our lookout rock. Then my sister and I escaped from an evil slug king and went back to my super twig fort for safety. Then we told stories till it got dark, and the Big Dipper led us all the way home.
Wow! Where were you, Jill?
We went to the forest. It's not that far away.
Ask your parents to take you and your friends to the forest this week. It's closer than you think. Check out discovertheforest.org. Brought to you by the U.S. Forest Service and the Ad Council.
Screening exams for breast, lung, or colorectal cancers are necessary to detect and treat disease at its earliest, most curable stage. But you may have some concerns and questions. Answer your questions and ease your fears by visiting radiologyinfo.org. In addition to information on screening and wellness, you'll find more than 200 descriptions of radiologic exams, procedures, and treatments to help you prepare. Get informed and be prepared. Visit radiologyinfo.org. Produced by the Radiological Society of North America and the American College of Radiology.
Introducing the YMCA. What, you already know the why? Or so you think. Sure, you know the why for a swim, a workout, even a game of hoops. But did you know we're more than that? We're a cause. When you take your jump shot at the Y, someone else is getting job training. Take a cardio class, while kids are in an after-school enrichment program. Practice your downward-facing dog as a teen practices her leadership skills. That's the why. We work with people no matter their age, income, or background and give them the opportunity to learn, grow, and thrive, all with one simple goal in mind, to strengthen our community. And we've got so much more that does just that. So while you might think of the Y as that place for lifting weights, we're also about lifting entire communities. Introducing the Y. We're so much more than a place. We're a cause. Visit ymca.net/more.
Moms, we don't know how you do it all, but you do. You are part teacher, counselor, chef, and doctor, all rock star. Being a mom today is complicated and sometimes unpredictable, but it's those precious moments that make your journey together crazy and wonderful. At the American Heart Association, we know your family is why. That's why we're here for you, to make sure more of those moments happen. To make sure a healthier, longer life is possible for you and your family. We're impacting laws that help shape healthier communities, but we can't do it without you. Moms are at the heart of change. So here's to you, Mom. Here's to impacting the health of our future. Moms United can make real change. Start by visiting lifeisy.org/moms. The American Heart Association and the American Stroke Association. Life is why.
Hi, this is Anne Marie from the great town of Kingston, and I support Kingston Community Radio, and so should you.
And so much for all those morning announcements. And don't forget, first day of spring today. Enjoy. We've got a couple nice days coming up. Monday, today and Tuesday are going to be a great day. So enjoy the well-deserved spring. Well, let's get to the on-air studio with Dr. Eric Stanberg. Good morning, Doctor.
All right, good morning. Welcome to this morning show, first day of spring, also known as Big Bird's birthday, for those of us who grew up watching Sesame Street. A little nippy out there.
Yeah, it starts out a little bit like 38, I think, right now. Mm-hmm.
And also having a little bit of a wardrobe malfunction this morning, where
it looks like you're already come straight from work.
I know. It's a button-down shirt, so I got one button intact on this side, but I've lost the button on the other side. So
I've had that happen.
Yeah, so I'm gonna be kind of flapping all day. I don't know. I might just kind of. You're right.
Put it up.
You can put the collar up like a cool guy.
Yeah.
All right, welcome to this morning show. I'm very excited for this morning show. This could be a little unusual. Robin will be joining us, but she actually has to leave early and go to a dental appointment, which, just always a reminder that we have to maintain our health. And actually, it's not easy to maintain your health. It's not easy to kind of go to the doctor or the dentist. It's gotten harder over the years. But we do have a guest coming, and I shouldn't say coming, he's calling in.
Excellent, I'll look for his call.
Mm-hmm. Yes. His name is Michael Minoritch, and he is a surgeon over at Vassar. He also works over at Northern Duchess. I always like to joke that he's a great young doctor who's been trained in this century, because, I wasn't. I was trained, in the 80s and 90s. But he, in addition to being a surgeon who does the duties of a general surgeon, he's more specifically a surgical oncologist or an oncologic surgeon. So he really specializes in treating people with cancer, particularly those who need cancer surgery, and also part of a very complicated and sophisticated team over at Vassar, which really does involve various types of surgeons, but also oncologists, hematologists, pulmonologists. I mean, it really depends. But treating cancer is pretty much a team sport a lot of times. So he's going to be calling in. I'm very excited. I've been trying to get him on the show for a while, but finally I spoke to his agent yesterday, and we're going to have an appearance.
What time will he be calling in?
What's that?
7:30?
I told him 7:15 or 8:15.
Okay.
So we'll see what happens.
Okay.
Until then, we shall keep the conversation going with various medical topics. As always, people are free to call in with any comments or questions. Phone number is 331-9255. Also, I'm already looking forward to the breakfast a week from tomorrow. Right? That's going to be at the Elks Lodge.
Yep, all of our listeners know about it, and I hope all of our listeners come.
7 to 9 a.m.
That would be quite a confab. We usually have about 7,000 visit.
I will be signing
listeners.
copies of my book.
Excellent. Okay.
Yeah, I don't know what book that is, but I'll just grab a book off the shelf. No, I don't want to mislead anyone. I have not written a book, so there's no book to sign. I do want to talk a little bit about concerns regarding COVID, unfortunately. And I've told people very honestly, I look forward to a week where I don't even have to mention it. But there is a slight trickle up of cases, and we have to be aware of that. Most mask restrictions really have been lifted. They're still in place for someone like myself in a medical establishment, and people who go to a medical establishment are supposed to still wear a mask. I think at Dan, what is the rule with wait staff and people who work at restaurants?
It has been in the past couple of weeks optional.
Okay.
Optional and to your discretion. Right.
And I always understood completely everyone's frustration and exhaustion with all of this. It's been a rough 2 years, so I do understand it. But this comes from the Freeman. On Friday, Ulster County reported another rise in active COVID cases. Numbers went from 98 to 120. I believe there was even a more updated article that I read yesterday showing, I think Ulster County, rather in an unusual move, reported some numbers over the weekend showing that things are also continue to trickle upward. There we go. That's what I was looking for. So it's still with us, and I wish we didn't have to continue to worry about it, but it does.
Did it happen in any particular part of Ulster County? Was it a small outbreak of some
That's
kind?
What I'm aware of. Did you hear something?
No, I did not. So that's why I thought I'd.
So what does that mean? Look, if you're in a place that still requires masks, I think you should abide by that. Remember, medical establishments like my office and other physician offices still have the requirement in place. If you're having symptoms in any way whatsoever, I think you should get tested. I hope we don't have another surge, but if we do, I think we will be more prepared this time than we were in January with more available testing. So as soon as you are concerned and think you might have some symptoms, you should get tested. Although, caveat emptor, sometimes the early test can be falsely negative. It is rarely falsely positive. If it's false positive, would be maybe if there's remnants of it from a case you had 6 weeks ago. That would maybe be a false positive. It's kind of like a home pregnancy test. You know the old joke about you can't be a little bit pregnant. I mean, if it's a positive test and you have symptoms, you should take it seriously. If it's a negative test and you're still having symptoms, you should also take that seriously. You should quarantine and maybe have another test in 48 hours. People ask me about what should the quarantine rules be? And I just say we should abide by what's being recommended. I understand the controversy. We had Dr. Liz Levine from Northern Dutchess a couple weeks ago, and she expressed concern about the shortening of the quarantine period from 10 days to 5 days. The logic behind that is that after 5 days, most of the contagiousness, if that's the word, contagiosity, has been minimized. So, I think you should abide by those rules. If you've been exposed and testing positive without symptoms, it's a 5-day quarantine. If you have symptoms, it is also a 5-day quarantine since the date of your first symptom. However, again, a couple caveats. You got to be feeling better. And you got to be feeling better for anywhere from 24 to 48 hours. I know it's a little subjective. What does that mean, feeling better? People get sick, and then even though they're better, they have bronchitis, they're still coughing for a week or two. But overall, they're better. So I understand that that's difficult. I wanted to talk a little bit about ivermectin, I've been not in favor of prescribing ivermectin because I adhere to the recommendations. I have a new phone, by the way, that supposedly has facial recognition, but I think the phone refuses to acknowledge that it knows me. So I have to keep typing in the code here. I don't know. I'm already having a testy relationship with this phone. Anyway, ivermectin. Okay. I did say, and I say this to students that I work with and residents. I say, don't put yourself in a corner. And maybe we are guilty of kind of doctor speak. We'll say something like, based on the current evidence, I do not recommend that. But that does, so rather than this is ridiculous, it's a foolish thing. Don't do it under any circumstance whatsoever. But I have been following the studies going on for ivermectin and seeing if, what's going on with it. First of all, that doesn't really make sense. Remember, it's a drug that has anti-parasitic effects. So why it somehow affects a virus is controversial. It is true that drugs will have multi-effects sometimes. Maybe it has antiviral properties. Maybe it has anti-inflammatory properties. That's part of the logic behind recommending this. We're in trouble here. Let's see. All right, I'm going to pull it up on the other phone here. But basically, it was a study about ivermectin. Let me see if I can pull it up again. But what happens is I read it, and then when I try to open it, it tells me I need a subscription. All right, so let's see. Here, all right, this is just one website. It says the largest study yet shows ivermectin failed to reduce COVID hospitalizations. So remember, when you study something, you need a study group and a control group. You can sometimes do what's called a retrospective study, which is you go back and you look at the cases. Hey, this person had the vaccine, this person had the medication. We can divide them into groups and see what happened. But this is a prospective study. So you're taking two groups, subjecting one to a type of treatment and not subjecting the other. And you got to control for similarities within the group, the age, other health problems, even vaccination status should be controlled for. And then once you can establish that the groups are similar enough, you give one a treatment and you withhold a treatment from the other. You have to kind of give a placebo treatment because there are studies showing that people will respond to placebo. And so the patient doesn't know what they're getting. That's called a blinded study. And to prevent any bias by the studiers themselves, they shouldn't know who's getting what until the study's done. That's called a double-blinded study. So whenever you might hear that sometimes in the news, double-blinded prospective study. All right, so this was a study that was done in Brazil. Anti-parasitic drug ivermectin became a partisan battleground during the pandemic. It was proposed as a miracle cure. Let's see. This is the first large prospective study that should really help the issue of putting it to rest. This was from someone named Peter Hotez, Dean of National School of Tropical Medicine at Baylor College of Medicine. So certainly I think I know this doctor. I've seen him interviewed on shows. So the study took place in Brazil. They enrolled, I'm going to round off numbers, but they enrolled around 1,400 patients. Half got a 3-day course of ivermectin pills. The other half got the placebo. Then they tracked how many patients were hospitalized over the course of 4 weeks, how quickly the patients rid the virus from their bodies, and death rates, among other variables. The researchers parsed down the data in a variety of different ways and found no instances where ivermectin impacted patient outcomes. I did read about ivermectin. It does, even I mentioned the anti-parasitic properties. It might have antiviral properties, but one article I read said that at doses that are much, much higher than is what is recommended for adults. Let's see. Again, it was a good study. And they compared. I could see people already criticizing that study. But why a 3-day course of ivermectin? Why not a longer course? Why? Maybe the dose was wrong. Maybe maybe there was bias of some sort. But from what I could peruse, other than maybe challenging the 3-day course of ivermectin, I could not find any major hole in the value of that study. It came from Brazil, by the way, which was kind of tied with India as the nation, second on the list with the most cases behind us. And even that's a controversial statement because there's variations in testing, going on between the nations. India has over 1 billion people, so my guess is they have many, many more cases that have just been up and diagnosed. I think it's probably the actual number of cases is very much underdiagnosed in our country. All right, so I wish I didn't have to bring that up again, but I did. So anyway, I will not recommend ivermectin. I will continue to not recommend it. I think the evidence is starting to come out. It's kind of underlying that it's just a medication that does not work. We had Dr. Tack on, a man who has worked tremendously hard over the past 2 years, along with other medical professionals, infectious disease, and he was very, made the point very clear. He said if he felt ivermectin worked, he would be giving it out left and right. He has no skin in the game to deny patients of ivermectin. Mm-hmm. It's actually not particularly costly, and it is fairly well tolerated at recommended doses. So when you read articles kind of talking about potential dangers of ivermectin, people will say, oh, they're just exaggerating those dangers to kind of discourage you from taking it. It's fairly well tolerated. The concern is that people will take it in excessive doses and set themselves up for problems with it. So I hope that puts to rest. That being said, we do have a treatment that I have been prescribing. It's called Paxlovid, and it have been. I prescribed it, I think, twice last week, okay? So certainly the number of cases is a trickle, but I wish there was no trickle.
And how do the studies play out with Paxlovid?
Well, I could try to pull them up, but very good.
You know them. I mean, just
these are antiviral medications. They're actually in the same family as medications that are used to treat HIV or hepatitis C. Those are other viral illnesses. If you look at the generics, they end with you learn a lot about medicines if you pay attention to the suffix of the generic names. So these tend to end with Avir, A-V-I-R. These are all medications in the antiviral family. Prospective studies of Paxlovid have shown a very dramatic decrease in serious cases of COVID, up between like 75 and even as high as 90%. It came out around the same time as Omicron and really Omicron caught us by surprise. And the supplies of Paxlovid kind of lagged, but the lagging is gone. It is available, and I did prescribe it last week. I prescribed it to a patient who had some risk factors for more serious cases. But because it's available, I don't know. But I'll continue to stay abreast of the recommendations. They haven't quite been lifted completely for prescribing it for less serious cases, but if and when we have another surge, I think we'll be more prepared. We were talking about ivermectin. Were you listening? Good morning.
Hi.
Robin's been recovering from bronchitis. I know she probably is upset, albeit already, for mentioning this, but bronchitis, we've talked a lot about in this show, it is almost always a viral illness, and antibiotics have no role. And to be honest with you, as a physician, I don't have much to offer people who have routine bronchitis. I can offer them some prescription cough medicine, sometimes some steroids and an inhaler. Really, you should avoid antibiotics in most cases because it's just not necessary. And it's anywhere from a 1 to 2 to 3 week of kind of misery. And even then, the cough could last for a longer time. I call that post-bronchial cough.
Very familiar.
Yeah?
Yeah, a number of years ago, I contracted it. It was, my doctor just said, you gotta weather it out. It's viral, so it doesn't go away instantly. It's a course, and I think you're strong enough to be able to get through it. Wasn't much to say. He gave me a few over-the-counter suggestions.
Yeah,
and that was it.
Yeah. I usually prescribe something called Tessalon, which is a prescription cough medicine. If the person has asthma or COPD, the bronchitis will exacerbate that. But really try to avoid prescribing antibiotics because it's just not necessary in most cases. So Robin's been saying to me for a couple of weeks, can't you cure this? Can't you cure this? And I've been saying, I wish. How are you feeling today?
It's worse in the morning. So
you sound a lot better today.
Yeah, it's I guess when you lay down all night, it like you get all that.
Yeah, the stuff.
Mm-hmm.
Stuff's got nowhere to go.
Mm-hmm.
Anyway, so I have seen a lot of bronchitis. It's out there. Patients have been calling with it. If you have bronchitis symptoms, COVID symptoms are a little bit different, but I do think you should, if you have any respiratory symptoms, I think you should be tested for COVID. The symptoms of bronchitis really are chest congestion and cough, usually productive of sputum. There's usually not much involvement in your nasal passageways, whereas COVID very much will have nasal symptoms, at least early on. So that's one way we distinguish it. But again, testing is readily available, so we should distinguish that.
Yeah, I had 3 COVID tests.
Did you pass?
Yes.
Yes. All right. So let's see so we have a guest, and he's going to call in, but I'm not entirely sure when. So we're just talking about random various topics until we have him call in. Is that okay, Robin?
Sure. We were just talking about this week about sinus infections and that what people are experiencing as far as like sinus infections now with COVID.
Yeah, that's always a good topic, because sinus infections and bronchitis are clearly probably number 2 and number 1 on the list of unnecessarily prescribed antibiotics. So I agree with that completely. Bronchitis, we've already established, usually does not need an antibiotic. And it's hard. It's hard to be the only person in the room not giving the antibiotic, to be honest with you. People go to various places, urgent cares, telemed. I have an article about one of my favorite topics, telemed here, once again, showing that the antibiotic prescribing rate is very high with telemedicine. Poor Robin. But sinus infections, I usually describe as colds that don't go away. A cold should last anywhere from 3 to 7 days. So if the symptoms are more protracted, it is possible that you have developed a sinus infection. A viral upper respiratory infection is by far the most common precursor to a bacterial sinus infection. But that being said, it's not that easy to distinguish, unless I order CAT scans on people for routine sinus infections, which is not practical. By the way, CAT scans will look at your sinuses. It's not practical to do that for every patient with possible sinus infection. That would be a misuse of medical resources. I'm having phone problems. But I do have my computer to set up, but I came in a little late. I didn't give myself enough time to set it up.
Oh, maybe during the break now.
All right, during the break.
Yeah. You are
okay.
you are well equipped. It's just
I don't know. I
it's
got
just a
two
learning curve, I
phones
guess, right?
They're working differently. I do have my alkaline water, though. Once again, giving a plug for alkaline water.
Why are you drinking alkaline water?
Well, first of all, water is good, and people have. I gotta offset the acidic nature of the coffee with the alkaline water. No, but a lot of people have acid reflux, indigestion. It's just it's kind of like having an antacid all day. The pH of this water. You remember the pH scale?
I remember that. Yeah.
Yeah, it's tough, isn't it? All right, we're going to our break on that note.
Okay, and thank you, Dr. Eric Stenberg and Robin Baker, for this Medical Monday. It's Monday, March 21st, first day of spring, 38 degrees right now here in uptown Kingston, and we'll be right back after these messages.
Hi, I'm Steve Thomas for Habitat for Humanity Restore. Habitat Restores are nonprofit home improvement stores and donation centers that sell new and gently used furniture, building materials, and appliances to the public at a fraction of the retail cost. The Ulster County Restore at 406 Route 28 in Kingston needs your donations. Call our hotline at 845-853-7499 to schedule your free pickup. And thanks.
Introducing the YMCA. Sure, you know the Y for a swim or a game of hoops, but we're more than that. We're a cause. When you take a jump shot at the Y, someone else is getting job training. Practice yoga as a team practices her leadership skills. We give people of all ages, incomes, and backgrounds a chance to learn, grow, and thrive. So while you might think of the Y as the place for lifting weights, we're also about lifting entire communities. That's the Y. We're so much more. Visit ymca.net/more.
Don't. Just don't. If you see a low-hanging or downed wire, don't touch it. Don't move it. Don't go near it. Don't drive over it. It may be a power line carrying an electric current strong enough to kill. But here's what to do. Stay at least 30 feet away and call 911. Central Hudson will take care of the problem. If you come close to a wire, shuffle away with small steps and watch your step. Wires may be hidden in fallen tree limbs or near water. Your safety matters.
Hi, this is Cameron Rylance from Kingston, and I support Kingston Community Radio because it's informative.
And you're with us here at KCR, Kingston Community Radio, AM 920 and 92.5 FM, and streaming online at mykcr.org. On this Monday, March 21st, obviously the official first day of spring. Sunny to partly cloudy today with a high of 57. And Monday night, tonight, partly cloudy skies with a low of 33. Tomorrow, sunny along with a few clouds with a high during the day of up to 55 degrees. And Tuesday night, a few clouds from time to time, a low of 29. Wednesday, considerable cloudiness, occasional rain showers in the afternoon, got about a 50% chance of that, with a high of 46. And Wednesday night, we can't avoid the rain there. Rain, definitely a 100% chance of rain on Wednesday night, and a low of 36 degrees. So it doesn't sound like snow. And this upcoming portion of Kingston Community Radio is being brought to you by Central Hudson. And don't forget, on Tuesday, March 29th, we are doing a live remote. So come and join us, have breakfast with us, and join Cameron Rylance and Nina Postjapak doing their normal show on location at 143 Hurley Avenue. And that's the Kingston Elks Lodge, 143 Hurley Avenue. All are welcome. We should have a great time.